Welcome to the Susan Brender Show. It's all about you. Featuring shows on health and wellness, the performing arts, politics, and people who inspire you to be your very best. And now, here's Susan Brender.
I'm Susan Brender, and this is the Susan Brender Show. Today, my guest is Ralph Sanchez. Now, Ralph is a complementary health care practitioner and currently maintains a consulting service in functional medicine that includes a particular emphasis on personalized brain health and renewal program. Mr. Sanchez resides in Northern California. Now, he holds a master's degree in traditional Chinese medicine, is a board-certified nutrition specialist, and his diploma certification is in homeopathic medicine. And I want to welcome to the Susan Brender Show, Ralph Sanchez.
Well, thank you so much, Susan, for having me on. I am so excited to talk about the topic of Alzheimer's disease and what one can do to reduce their risk for it. It's such an important item in our society, and so it's just a pleasure to be here. Thank you for inviting me.
Well, you're quite welcome. Now, here's the thing. I know that this is a very elementary question, but I have to really ask you because there are people who wonder, how do you define Alzheimer's disease?
Well, that's a great question because it's a very difficult diagnosis, if you will. It involves some extensive analysis and testing to surmise that one or a patient has Alzheimer's disease. And let me just define a couple of issues around Alzheimer's disease. There are two forms. One is pretty much genetically determined, and that's called early onset Alzheimer's disease. And then there is the type that most people are familiar with because it comes on with aging, and that is referred to as late onset Alzheimer's disease. And the risk for late onset Alzheimer's disease is significant. And of course, you asked about how we would know that somebody might have Alzheimer's disease or how is it diagnosed. Yeah. It begins with the signs, the observable signs that people are having difficulty coping. They're not thinking that clearly. Of course, their memory is starting to fail. They're unable to perform a task surrounding their living environment, maintaining their home, keeping up with the bills. It's a real issue in terms of their cognitive health. They're not able to execute their daily normal activities and necessary functions that they need to maintain a normal life. And so that becomes noticeable, and that's when hopefully a family member would begin to intervene and get them to a neurologist for an examination. And then they would be put through a series of what are called neuropsychological tests. A very well-known one is the mini mental exam, and there's many others that are actually used quite a bit in the clinical setting, and that is a window that most people begin to use to start to understand that somebody is having, some cognitive decline and probably is already in a dementia state. Whether that's Alzheimer's or not is something that would require further testing and analysis. And unfortunately, Alzheimer's is often misdiagnosed. In other words, people can have lots of other issues related to cognitive health and dementia that's not Alzheimer's. So Alzheimer's is the leading cause of dementia, but the second leading cause are vascular-related problems, and so that's referred to as vascular dementia. And so then there's Lewy bodies dementia, which is right up there in terms of a type of dementia and the types that are more prevalent. But what happens often as well, too, is that as one ages, and this is what I really hope to get to the call, particularly in terms of the overlapping here of, say, a vascular dementia and Alzheimer's disease, is that it becomes a mixed dementia. In other words, you'll have a vascular disease that causes, dementia-type symptoms and the disease process, but you can also have Alzheimer's brewing at the same time. So that will be referred to as a mixed dementia. And all of that makes it difficult to diagnose unless you go through an extensive battery of tests that includes MRIs and PET scans, where they determine based on the lesions that can be analyzed through these neuroimaging windows, and they're looking at the proteins that are involved that form the lesions that are correlated to Alzheimer's disease, and that's called amyloid and tau protein. And as the disease progresses, amyloid protein aggregates into amyloid plaques, and then tau protein actually is another protein in the cell, and it becomes disassembled in the construction that it fulfills in terms of it's sort of a skeletal structure in the cell, but it has a very important role there, but it disassembles and it aggregates as well into what are called tangles. And those two proteins can be examined in terms of, the levels. Cerebral spinal fluid is another way of looking at that. So there's many tests like that can be done to sort of examine the levels of these proteins and determine that one more accurately has Alzheimer's disease. But usually, in most cases, it's usually done through these neuropsychological tests and through a few other tests that a neurologist may perform as well, too.
Yeah. Ralph, give us some indication of what the tests include. Say, for instance, a spouse, and I'm talking about a couple, and one of them is showing signs of memory loss and short-term memory loss and various other symptoms which really perhaps indicate that this person is starting to suffer from onset of Alzheimer's. Now, with that said, they walk into an office. The process, the way that things are going to happen once they go into a neurologist's office.
Well, that's really an interesting scenario that you're presenting, because it's going to be quite different depending upon the individual involved and the family members, because say, for instance, in my mother was very resistant to the idea of going to a doctor. And every time the topic was broached around her state of mind, she would become very defensive, and she didn't want to accept the fact that she was having a problem. And of course, then there are other individuals that will, start to notice themselves that they're having difficulty and will reach out for help. And that will be another scenario, of course, because they're motivated to find out what the problem is and see if there's any possible solutions. Now, what happens thereon is that, based on what the individual, if they're able to report about what is going on with them and what the family members also volunteer, if they're part of the equation, then the doctor or neurologist is going to perform, these neuropsychological tests, and there's many, but the mini mental exam, of course, is one that is commonly used. As a matter of fact, we couldn't get my mom to a doctor after an initial encounter her with a physician that we got her to. We got her to a neurologist, and
Yes.
he was, sometimes physicians don't have the greatest bedside manner, and he scared her. He scared her, and yeah, he scared her into thinking he was going to pull her license, which, yes, needed to be addressed, but not in the way that he was proposing, which was to report her to the DMV. So some of these things have to be broached very carefully because, it can feel so threatening to an individual to all of a sudden be told that their liberties are going to be taken away. So that's why it's a difficult scenario to paint, because it's going to be so different depending upon the willingness of the individual to address what actually is going on, how supportive the family members are in the process, the bedside manner of the physician. There are so many things that come into the equation. But
I am so happy you brought that up. I have to say to you that, as I indicated prior to us actually starting the interview, my mother also suffered from dementia. And it's so interesting that whatever you're talking about, we faced a resistance and I think most importantly, a fear. And the reality also is that the doctor that we took her to, which was a neurologist, also had a lousy bedside manner. And it's like, for the family, he said to us, well, you have to accept the fact that this is the way it is. And what do you mean? I mean, we were frightened to death, too, to see our family member be in this state of mind and scared and put into a situation where she was just another person, just another patient who comes in, rather than the kind of bedside manner that you exactly talked about, which would be, let's talk about this, let's see whether, we can do some things to make you feel better, and, that sort of thing. I just wonder why, with the onset of so many people dealing with this disease, that the medical community is not really aware of the best way to take care of these people. What do you attribute that to?
It's a lack of education and understanding of the disease process. So that's exactly what's going to happen in many cases, particularly if you're, say, in an insurance plan. These physicians are not prepared to deal with these types of problems. They don't really understand what is available and how to go about, the best way to go about, providing services and directing the family towards resources. That's not something that they're equipped to do. You have to go to a specialist, and you have to go to somebody that hopefully has a good reputation, that they've, obviously accrued and seen many patients and help them with getting on board with things that could be useful for them and the family members. Now, you paint a scenario there that's quite well described in the medical community, because as we stand right now, there is a huge transformation going on in terms of how to address Alzheimer's disease. It is projected to be a pandemic, and the rates of incidence and the prevalence that they're predicting over the next 30 years. So if something isn't done about this in terms of the cases that are continuing to grow year by year as far as diagnosed cases, it's going to create an astounding financial burden that, as many people describe it, threatens to break the bank, so to speak. So what's happening now is, because all the drug trials have failed, nothing has surfaced. There is a few approved prescriptions for Alzheimer's disease, but they only slightly modify or attenuate the disease process. There's absolutely no cure. It's a temporary solution that might slow the decline for 6 months to a year, but it doesn't really do much after that. And the side effects are significant. So as I said, because of all of this, it's pretty bleak in terms of if you look at the drug model and the projected rates of Alzheimer's into the future. So the medical community over the last few years has been really looking at prevention and risk reduction is really the solution as we speak.
Yes.
And it's becoming available. You just have to know how to access these resources. But there are clinics and physicians around the country now that are operating on a prevention level, or if somebody actually is in more severe cognitive decline, they're able to more significantly address the issue through more holistic means, if you will. And
that brings up, let me interrupt you for just a second. That brings up a whole new subject, in a sense, the holistic side of things. And when I introduced you to the audience, I mentioned, because needless to say, this is part of your life and your program, that you're involved with regard to you're a nutrition specialist, a board certified one. So that might indicate that there is some kind of connection, if you will, to nutrition and Alzheimer's or dementia, if you will. Am I kind of putting it correctly? Is there a connection?
Yes. So in my book, The Diabetic Brain and Alzheimer's Disease, I actually have a small introduction into terms that people might want to get familiar with so that they understand what's available outside of the mainstream of Western medicine. And there are a lot of progressive physicians, a lot of progressive practitioners that incorporate a more integrative model into their practice, and it has a holistic bent to it. And there are different terms that are used for it. One is called personalized medicine. And personalized medicine has gone through, an evolvement, but it began out of the genomic studies that were done, the Genome-Wide Association Studies, GWAS. And this is where the genome was mapped, and it provided just a great deal of information to the medical community in terms of understanding some of the risk factors that are involved in certain disease processes. And certainly in the case of Alzheimer's disease, we've known for a long time that there is one primary risk factor, and this is what really started to grab my attention over 20 years ago, that got me on this bent of research and, a goal of writing books on the topic, because I had assessed myself as through some risk factors that I had accrued in my lifetime, that I was at risk for a cognitive decline and dementia as I aged. And when I started looking at these issues, I ran into some information around a well-known and validated genetic risk marker for late onset Alzheimer's disease, because again, there are genetic determinants for early onset Alzheimer's disease. So the one for late onset Alzheimer's disease that increases your risk is called A, P as in Paul, O, E4, ApoE4. And that one is well known and validated. But the GWAS unveiled a host of other genes that all of a sudden started to, and they were being looked at anyways, but it started to bring more attention to the topic, and that's where personalized medicine grew out of, which was to leverage genetic profiles in an individual as a way of understanding some of the risk involved for certain diseases, or why a person was beginning to already shunt into a scenario with a particular disease process. So there are many ways of looking at, risk, and personalized medicine began with looking at genetic risk, and it's evolved into a more holistic bent, which is not just the genetic component, but looking at the biochemical and the metabolic components to the disease process that could be viewed through other windows and other assessments. And similarly, another term grew out of that movement, which is referred to as precision medicine. So there are many progressive physicians out there that are using a personalized or precision medicine approach, which is a more tailored approach to the individual. And that's looking at a lot of factors that might be involved in not only the eventual onset of a disease, but why a disease is starting to manifest, and also to help in the diagnosis. I was inspired early on in my work as a practitioner. I started out as an acupuncturist, but I knew going into to that study and eventually into my practice that I was going to be very integrative. Nutrition was something I really loved, and so I discovered a model of medicine that's referred to as functional medicine. And functional medicine, like precision medicine and personalized medicine, looks at, the individual, and very carefully looks at history, all of the risk factors. So it's a very personalized approach. And a mentor of mine, who is considered to be the father of functional medicine, his name is Dr. Jeffrey Bland, and he defines functional medicine in a very brief way by saying it's a patient-centered medicine versus the drug-centered model of Western medicine. So functional medicine and personalized medicine and precision medicine, really is bent on looking at the causes and looking at the individual factors that are involved with those causes that leads to the expression of a disease process.
Ralph, there's something that kind of makes me think. We have a real, you talk about pandemic, and a real crisis, if you will, in terms of obesity in this country. And I'm just wondering whether there's any connection between obesity and Alzheimer's. And the other question that I would have, really, and the other question I have for you is that you have a master's degree in traditional Chinese medicine. Now, I don't know whether there's any difference between the numbers of people or the statistics about America versus, say, for example, Europe, say, for example, maybe Central America, South America, all these other continents also. Do we have more Alzheimer's as a result of the fact that our diets and our obesity issues are just greater than those which are found in these other countries?
Well, you hit on a very important point to all of this. First of all, obesity is definitely correlated to an increased risk. And that's where I mentioned previously about cardiovascular disease. So my book, again, is about the understanding that the common age-related issues that most people encounter in their lifetime, which is heart disease and diabetes and obesity, those are the major risk factors for dementia and Alzheimer's disease as one ages. And in terms of the rest of the world, these rates or incidences of Alzheimer's climb as soon as a Western diet and a Western lifestyle is adopted. So in indigenous cultures, that maintain, their traditional lifestyles and diets, that is not necessarily as huge a problem, okay? Because they're eating the types of foods that are protective. For example, the Mediterranean diet, is associated with a decreased risk and incidence of Alzheimer's as one ages. And my second book is actually all about the nutritional side of it. It's called The Improved Mind Diet, and it's based on studies that looked at the Mediterranean diet, and they actually tweaked the Mediterranean diet and called it the Mind Diet, and showed that the Mind Diet performed somewhat better than the Mediterranean diet because it focused on the foods that were shown already in studies to be the most beneficial for cognitive health and the prevention of cognitive decline.
Incredible.
So these elements of nutrition and lifestyle are critical. And this is where the science is headed, and already is quite vibrant, because it's showing that these are real ways that you can implement, in a lifestyle, or that physicians can start to utilize. I talked about clinics and physicians, that are emphasizing early intervention and assessment. So we now know that midlife is a critical time in one's life to begin to take control, as I put it. You can begin to take control, and you need to take control of your risk factors at midlife, because we understand that Alzheimer's disease has a 20 to 30 year time window where it develops. In other words, in the beginning, you don't know. There are absolutely no symptoms associated with the disease process. It's silent. It's called the preclinical stage, where there are no clinical symptoms whatsoever. And then there is another stage, which is called mild cognitive impairment. And that's when you begin to see cognitive decline, like memory loss.
Right.
And that precedes most of the cases. I would say at least half of the cases, depending upon the study that you read, half of the cases of mild cognitive impairment go on to develop some sort of dementia or Alzheimer's disease.
Well,
and there are different.
I just, again, forgive me for interrupting you, but a lot of people, their families, of course, the hereditary aspect of things, where their families have had dementia or Alzheimer's, and there's a fear. And I have to be very honest with you. When people have said to me, well, my mother had it, and actually an aunt of mine, my mother's sister, had it as well, and they say, well, there is a chance, because of your close family had it, that you should go and get tested or something like that. But I'm afraid to be honest. I'm not sure I want to, and I think a lot of people also think the same way. But it sounds like you feel that it would be best to do it, because there might be eventually a way to prevent it, or
Absolutely.
even if it. Okay, so just address that for a second, because I think it's a very real problem. People are scared. It's frightening.
Absolutely. And so there is two scenarios that you are beginning to describe. People that are afraid to find out if they're at risk, and also the people that are wanting to know if they're at risk, because they feel like they might be able to do something about it, especially as they start to read information that's percolating through the media, that early assessment and early intervention, can be a model for prevention.
Yeah.
And
Yeah.
at the very least, it could be a model for delaying the onset. In other words, for example, 1 in 10 Americans after the age of 65 will have Alzheimer's disease.
Wow.
And that increases to 3 to 4 if you live to be older than 85. Okay?
Mm.
So,
Scary,
yes, it can be very scary, but again, as I've said several times here, the science is really going towards all the ways that we can reduce the risk and possibly prevent. And if you have it in the family, you definitely are at increased risk, particularly if it was on your mother's side. There are issues related to maternal inheritance that are quite significant. So if your mother had Alzheimer's disease, then you definitely are at an increased risk. But they have done studies. And families where Alzheimer's has been part of the history, the individuals have a higher rate of Alzheimer's disease, family members.
I have to bring up another point, and we really are going over our time for the moment, but I can't help but ask you this. There are two other things that I'm curious about, and one is the facet or the introduction into people's lives where they have a lot of stress. And in today's world, we're dealing with an enormous amount of stress. So my question to that is stress one of the also factors in causing, if you will, Alzheimer's in terms of the combination between that and nutrition and, of course, genetics and as such. But stress is another thing. And the other issue is that people find themselves, when they get older, very much alone. And loneliness, as I think was a contributing factor to my mother's dementia, is very frightening as well, because people suddenly, in their glorious part of their lives, which should be anyway, are very lonely. They lost all their friends, their family, and things of that nature. Have you dealt with that? Have you talked about that as well in your books?
I don't deal with the loneliness factor. And as I mentioned in the Diabetic Brain and Alzheimer's disease, many of the risk factors that you just mentioned, like stress, are important things to evaluate. I have a Facebook group community, and I just posted the results of a study that showed that women that have elevated levels of stress hormones, one of them is called cortisol, at midlife, which means that they are incurring perhaps more significant amounts of stress over their lifetime. But elevated levels of cortisol is a risk factor for Alzheimer's disease later in life. So this is the midlife factor. And there's actually other very important factors at midlife for women, like estrogen. But stress is definitely one of them. And so that's something that should be evaluated and looked at, because if you're not doing stress modification of some sort, then combined with many other factors, it could be a component to your cognitive decline. Now, you mentioned loneliness as well, too, as a possible issue. So one of the things, I have a third book planned, and that third book is going to be around a topic that's referred to as neurogenesis. And neurogenesis represents the growth of new brain cells, right? And this is one of the topics in the research that's being leveraged for prevention. So when we talked about nutrition and lifestyle, there are many factors in lifestyle and nutrition that actually promote the generation of new brain cells, or neurogenesis. And neurogenesis is a hedge against the onset of Alzheimer's as you age. And one of the things that promotes neurogenesis is social engagement, social activity. So yes, if you have many years where you're not socially engaged, if you don't have other factors that are working for you, and loneliness creeps in over the years, it can be a factor. It can be a factor because you're not getting the brain stimulation that you need to keep your brain as healthy as possible. And so that can be a very important aspect of
that's so interesting. It really is fascinating. The whole subject matter and everything that you've talked about is really fascinating. So tell our audience again about your books. Number one, how did they get them? And number two, the names of them, and anything that you think would be important for them to know about the book.
Yes. Well, the book, first book is The Diabetic Brain and Alzheimer's Disease, and that is available on Amazon, or they can go to my, I have a page dedicated to the diabetic brain, which gives them some information on what it's about. And the page is thediabeticbrain.com. And if they want to find out more about the book, they can go there, or they could go Google the name, The Diabetic Brain and Alzheimer's Disease, on Amazon. I said Google, but you would put it into the Amazon search field and pull that up that way. I can also go to my website, the Alzheimer'sSolution.com, and be privy to all the resources I have there. And of course, I have my program, which is Brain Defend, my Brain Defend Body-Brain Renewal Program, which is designed to really help people get started on a track where they're implementing all the important things that we talked about that are, building cognitive health and preventing cognitive health as they age. And so they're carefully guided with nutrition and lifestyle, and they're referred to various tests that are very important to look at numbers. Like the book is about, as we've discussed here at various points, about the association, the link between cardiovascular disease and diabetes, obesity, and the risk for vascular dementia and Alzheimer's disease. So looking at things like fasting glucose, looking at things like hemoglobin A1C, which is associated with fasting glucose, and looking at issues related to cardiovascular health. Like the circulation in your brain is really important. So if you have cardiovascular disease and you have impaired circulation to the brain, that's a huge risk factor. So there's a lot of tests that are easily available where you can start looking at these risk factors. And this is what I do in terms of guiding people through all of this in my program, to make sure that they're looking at these things and able to start taking control through diet, through lifestyle, through supplementation. Sometimes supplementation is extremely important. There's one genetic risk marker that's all about, it's well known, it's all about folate or folic acid. And for example, if you have low levels of folate throughout a lifetime, that's correlated to brain shrinkage. Okay?
Right.
Brain shrinkage or brain atrophy is a marker that can be seen on these neuroimaging exams that we talked about. It's something that can be evaluated, and it's predictive of Alzheimer's disease. So as your brain shrinks, you develop dementia or Alzheimer's disease. And what is the counter the idea of a shrinking brain is a growing brain, which is neurogenesis, right?
Isn't that something?
Yeah, so these are really important things to be aware of. And the ApoE4 gene that I mentioned, that's associated with an increased brain shrinkage as one ages. So it's important to know all these things because, as I said, you can sort of influence the problems that are associated with these risks and start to take more control. And that's what the book, The Diabetic Brain, repeats over and over and over again, that midlife is really important, that looking at these risk factors and using lab assessments and working with progressive physicians, these are all critical aspects of aging and taking control of your risk for Alzheimer's disease as you do.
Well, my guest today has been Ralph Sanchez, who really knows his stuff. With regard to Alzheimer's, he's written a book called The Personalized Brain Health and Renewal Program he's put together. That's your program.
And the book is The Diabetic Brain in Alzheimer's Disease.
Yes, and I really think, Ralph, that you're a man who people need to listen to. You've done your homework, and you really understand some of the ways to prevent or deal with this horrendous and unbelievable disease that is facing people all over the world. And so I want to thank you for being on the Susan Brender Show, and I would love to have you on my show again because I think that we just even tapped into some of the things that people need to know, but there is so much more that I'm sure you can discuss with them or discuss with me and offer our audience an understanding and a sense of what they can do about this particular disease. So thank you.
I'd love the opportunity to do that again, and thank you so much again for having me on today.
Well, it's my pleasure.
Thank you for listening to The Susan Brender Show. To be a guest, email sebrender@yahoo.com.